Welcome back to your channel. Today we talk about diabetes. What is diabetes? Diabetes mellitus, commonly known as diabetes, is a group of metabolic disorders characterized by a high blood sugar level over a prolonged period of time. If left untreated, diabetes can cause many health complications. Acute complications can include diabetic ketoacidosis, hyperosmolar hyperglycemic state, or death. Serious long-term complications include cardiovascular disease, stroke, chronic kidney disease, foot ulcers, damage to the nerves, damage to the eyes and cognitive impairment. Diabetes is due to either the pancreas not producing enough insulin, or the cells of the body not responding properly to the insulin produced. There are three main types of diabetes mellitus. The diabetes types. The diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. With diabetes, your body either doesn't make enough insulin or can't effectively use the insulin it does make. Untreated high blood sugar from diabetes can damage your nerves, eyes, kidneys, and other organs. There are a few different types of diabetes. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys cells in the pancreas, where insulin is made. It's unclear what causes this attack. About 10% of people with diabetes have this type. Type 2 diabetes occurs when your body becomes resistant to insulin, and sugar builds up in your blood. Prediabetes occurs when your blood sugar is higher than normal, but it's not high enough for a diagnosis of type 2 diabetes. Gestational diabetes is high blood sugar during pregnancy. Insulin-blocking hormones produced by the placenta cause this type of diabetes. A rare condition called diabetes insipidus is not related to diabetes mellitus, although it has a similar name. It's a different condition in which your kidneys remove too much fluid from your body. Each type of diabetes has unique symptoms, causes, and treatments. Learn more about how these types differ from one another. What are the symptoms of diabetes? Diabetes symptoms are caused by rising blood sugar. The general symptoms of diabetes include increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, sores that don't heal. Symptoms in men. In addition to the general symptoms of diabetes, men with diabetes may have a decreased sex drive, erectile dysfunction, ED, and poor muscle strength. Symptoms in women. Women with diabetes can also have symptoms such as urinary tract infections, yeast infections, and dry, itchy skin. Type 1 diabetes. Symptoms of type 1 diabetes can include extreme hunger, increased thirst, unintentional weight loss, frequent urination, blurry vision, tiredness. It may also result in mood changes. Type 2 diabetes. Symptoms of type 2 diabetes can include increased hunger, increased thirst, increased urination, blurry vision, tiredness, sores that are slow to heal. It may also cause recurring infections. This is because elevated glucose levels make it harder for the body to heal. The diabetes prevention. Type 1 diabetes isn't preventable because it's caused by a problem with the immune system. Some causes of type 2 diabetes, such as your genes or age, aren't under your control either. Yet many other diabetes risk factors are controllable. Most diabetes prevention strategies involve making simple adjustments to your diet and fitness routine. If you've been diagnosed with prediabetes, here are a few things you can do to delay or prevent type 2 diabetes. Get at least 150 minutes per week of aerobic exercise, such as walking or cycling. Cut saturated and trans fats, along with refined carbohydrates, out of your diet. Eat more fruits, vegetables, and whole grains. Eat smaller portions. Try to lose 7% of your body weight if you're overweight or obese. What are the causes of diabetes? Different causes are associated with each type of diabetes. Type 1 diabetes. Doctors don't know exactly what causes type 1 diabetes. For some reason, the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Genes may play a role in some people. It's also possible that a virus sets off the immune system attack. Type 2 diabetes. Type 2 diabetes stems from a combination of genetics and lifestyle factors. Being overweight or obese increases your risk too. Carrying extra weight, especially in your belly, makes your cells more resistant to the effects of insulin on your blood sugar. This condition runs in families. Family members share genes that make them more likely to get type 2 diabetes and to be overweight. Gestational diabetes. Gestational diabetes is the result of hormonal changes during pregnancy. The placenta produces hormones that make a pregnant woman's cells less sensitive to the effects of insulin. This can cause high blood sugar during pregnancy. Women who are overweight when they get pregnant or who gain too much weight during their pregnancy are more likely to get gestational diabetes. The bottom line is both genes and environmental factors play a role in triggering diabetes. What are the diabetes risk factors? Certain factors increase your risk for diabetes. Type 1 diabetes. You're more likely to get type 1 diabetes if you're a child or teenager, you have a parent or sibling with the condition, or you carry certain genes that are linked to the disease. Type 2 diabetes. Your risk for type 2 diabetes increases if you are overweight, are age 45 or older, have a parent or sibling with the condition, aren't physically active, have had gestational diabetes, have prediabetes, have high blood pressure, high cholesterol, or high triglycerides, have African American, Hispanic or Latino American, Alaska Native, Pacific Islander, American, Indian, or Asian American ancestry. Gestational diabetes. Your risk for gestational diabetes increases if you are overweight, are over age 25, had gestational diabetes during a past pregnancy, have a given birth to a baby weighing more than 9 pounds, have a family history of type 2 diabetes, have polycystic ovary syndrome, PCOS. Thanks for watching. If you like the video, support us by subscribe and like.